Welcome back to Nowhere Near Done. Today's guest is someone many of you have already heard me talk about on the podcast. Dr. Susanne Ramos is my OB-GYN, a menopause specialist, and the founder of Ramos Women's Wellness Center here in Santa Barbara. And over the years, she has also become a good friend. And before we jump in, I have to acknowledge this is actually the second time recording this episode. If you follow me on social media, you probably heard me mention the infamous microphone mishap where I accidentally recorded an entire interview with the microphone muted. Unfortunately for Dr. Ramos, she was the victim of that particular learning experience. Thankfully, she was gracious enough to come back and do it all over again. In this conversation, we dive into what is actually happening in our bodies during perimenopause and menopause, why so many women feel dismissed when they seek help, the latest thinking around hormone replacement therapy, and the lifestyle changes that can help us feel stronger, healthier, and more empowered as we age. We also talk about sleep, anxiety, weight gain, brain fog, libido, joint pain, longevity, and why this phase of life should be viewed as a wake-up call to start prioritizing ourselves, not the beginning of the end. If you've ever wondered whether what you're experiencing is just aging or if there might be more to the story, this episode is for you. Here's my conversation with Dr. Susanne Ramos. So, Dr. Ramos, thank you again so much for joining me. This is the second time we are recording this because last time I accidentally muted the microphone. So I really appreciate you coming back and doing this
Oh,
for a
no, it's
second
my
time.
pleasure to be here, so no worries.
I'm so excited to have somebody who is such an expert on the topic. But first, I like to get a little bit of background on my guests. So tell me a little bit about your journey into women's health and what led you into that particular profession.
When I was an undergrad at UCLA, I
Uh,
volunteered at UCLA Hospital, and you go everywhere, but I was very attracted to the labor and delivery unit. Continued through my studies at Georgetown Medical School
uh-huh.
and led me to choose the field of women's health.
Okay.
I was always interested in all aspects of women's health, and
Uh-huh.
so it was a really hard decision when you were choosing your residency. Do I just do OB-GYN, or do I do reproductive endocrinology, or do I do gyne oncology? So I was really attracted to basically the total women's health
Uh,
journey throughout their lives.
yeah.
And so that's what really drew me to this.
Okay.
I've been blessed being an obstetrician and gynecologist. You do get to develop these special relationships with women
Uh-huh.
and all through aspects of their lives. I've seen women from their teenage years through delivering their babies, when they get married,
Mhm.
to now entering the menopause area. Also, I
Uh-huh.
go through it as
Right.
well,
Yeah.
something I can relate to.
Uh-huh.
And I just want to empower women because for so long, we have not been the center of medical attention. 50% of the population is women. And why are
Right.
there not any studies?
Yeah.
The studies on cardiac, neurological, bone health is all based on men.
Uh-huh.
And I think I didn't realize that until I really started to explore
Uh-huh.
how menopause affects our health and
Uh-huh.
all aspects of our health.
That leads into the next part of it. You have been an OB-GYN for a number of years, and it's recent that you went back and got this specific certification.
The
with
menopause certification,
Huh?
right? Because unfortunately, we did not. The medical world, once again, did not realize or did not care about women's health.
Right.
So none of us learned this in medical school,
Uh-huh.
not even residency. We were
Yeah.
focused on, of course, obstetrics and gynecology, but this was a part of aspect of gynecology that no medical training
Right.
existed, and
Yeah.
now it's coming available. And so
Yeah.
I did pursue. I really studied hard,
Uh-huh.
read many books, done many classes
Uh-huh.
to really educate myself on how to optimize my care for women. It's through NAMS, as American Medical Society that started to come alive, I think, in the early 2000s, to specifically focus on women, which is actually hormone replacement therapy. And the whole thing blew up
Got it.
with the Women's Health Initiative study, which
Uh-huh.
a lot of misleading information led to basically depriving women of menopause therapy, which a lot of women would have prolonged their health
Right.
if they received.
Yeah.
So it divides from that. And then I think as more women are entering the health field, I
Uh-huh.
mean, they're predicting 50% of healthcare providers will be women by 2030.
That's
I think that's
fantastic.
empowered
Yes.
the medical,
Uh-huh.
us women, to say what's going on here, why were studies done, and to
Yeah.
really dive into the misinformation that was derived from the Women's Health Initiative
Yeah.
study.
What is perimenopause, menopause? Explain it in terms of what's happening inside of our bodies.
Sure. So basically, perimenopause and menopause is just a normal transition that we all go through as we age.
Okay.
So I think sometimes the media is making it out to be a disease, but it's just a normal transition, just like when we started puberty.
Mm.
As we go older, our ovaries basically start falling asleep, I like to put it.
Okay.
And as they fall asleep, they don't produce the same hormones that our bodies have been used to since basically puberty.
Hmm.
So, what does that mean? That means for the last 20 to 40 years, depending on when you started your cycles, but basically your body's been used to this hormonal pattern that's been regular. Our ovaries produce two hormones. One is estrogen, which is produced by the granulosa cells, the follicles in our ovaries, which hold our eggs.
Okay.
So every month, once they start waking up, that's what starts to be produced when they start to wake up and we're in puberty. Estrogen basically affects, there's estrogen and progesterone receptors throughout our body. And so it makes sense why we're getting a multitude of symptoms when those levels drop.
Okay.
So basically, we start to have this pattern that our bodies work on where estrogen rises during the first half of our cycle called the follicular phase. And then basically progesterone is only produced when we actually release that egg, and that then rises in the second half of our cycle. And then if we don't get pregnant, both hormones drop and we have a period.
Okay.
So the first step that happens makes sense as our ovaries start to fall asleep is releasing that egg, and that's why it is harder to get pregnant
Okay.
when we get into this perimenopause. And basically, perimenopause is somewhere between 40 to 60. It's the 8 to 10 years before our ovaries start to fall asleep.
Hmm.
Menopause, by definition, is when we're on the other side, when we haven't had a period for over a year. And basically, that's when our ovary has fallen asleep completely.
Hmm.
Because what do those two hormones do? Estrogen to our uterus stimulates lining to prepare for pregnancy, and progesterone makes it a happy environment for implantation if we do get pregnant. And if we don't get pregnant, both those hormones drop and we shed that lining and we grow it again each month. So the first hormone that's not produced, the first function our ovary loses as it falls asleep is releasing that egg each month.
Okay.
That's why it is harder to get pregnant as we get older.
Okay.
And so what does that mean in regards to our hormones is we lose progesterone.
Okay.
And the lack of progesterone can not only lead because it tells our body when to have a period, but also cleans out the lining adequately. So if we're not producing enough progesterone, we're not mowing our lawn adequately.
Okay.
So that's why we start to get these heavier periods, irregular bleeding, because our body doesn't know truly when to have a period.
Okay.
But also, progesterone affects us in a lot of ways. Insomnia, all that
Okay.
worsening premenstrual symptoms,
Mhm.
irritability. So all those things are initially a sign of a lack of progesterone.
Okay.
And so we start to supplement these things. That's what menopause hormone therapy is all about. Exploring and educating myself through the last couple of years have really opened my eyes to the effects that hormones have on our whole body, our whole health.
Mhm.
And I want to help improve women's lives throughout their entire lives.
I think for our mothers, they
Correct.
went through this without really having the language and the understanding of what was actually happening in their bodies and that there might be something they could potentially do to
Do
feel
to help,
better.
correct.
Mhm.
So we're just starting to initiate studies for women's health because there is no data. And unfortunately, society has made I think women were shamed that when they lost their cycles, they couldn't get pregnant anymore and they were embarrassed. And so they didn't really seek help for all these symptoms that they were having in our mom's generation.
Uh-huh.
And quite frankly, doctors didn't know what to do with these symptoms. They would blow it off to, oh, you're depressed and all these non women's issues.
Mhm.
So, yes, I think it's an area I'm so excited and happy that it's getting so much attention now.
Mhm.
And now we're starting so many studies so we can really learn
Mhm.
to see what is the best treatment for all of our symptoms and how we can basically improve our longevity to be as healthy as possible so we can continue to do all the things we want to do.
Like you said, it's not disease, but there are things that we can do to be
Proactive.
proactive and more comfortable and
Right.
live longer, healthier,
It's
happier.
all about
Yeah.
prevention,
Okay.
right? Yeah.
Yeah.
to prevent all the cardiovascular disease, the bone fractures, and, dementia is all brain health. Why do more women get Alzheimer's? I mean, I'm sure it's linked to hormones in some way, but
Mhm.
we still don't know.
We haven't gotten there yet.
Mhm.
So let's kind of talk about then some of those earliest signs of menopause. You kind of talked about it a little bit, but when you start to lose progesterone and then when you start to lose estrogen, what
Correct.
happens in
So everybody's body is different, so that's also makes it more challenging.
Mhm.
You can't it's not a cookie cutter that you everyone gets the same regimen because everybody is so different. It's just like when we started our periods, puberty, we all had different experiences in the same way. Some people get worse, really bad PMS, they get depressed.
Mhm.
These are all things that is helpful to know maybe how you will go through perimenopause and menopause. And now there's lots of data to show like how you tolerated pregnancy.
Oh,
Where you
interesting.
did you have really bad symptoms? Did you develop preeclampsia, eclampsia? All those are signs of cardiovascular markers, and that we need to be a little bit more preventative for those patients.
Okay.
So just having a provider who listens and goes through your complete women's health journey
Mhm.
can elicit what we may give you to prevent further disease.
Mhm.
But because every cell in our body has estrogen receptors as well as progesterone receptors, it makes sense that there are so many symptoms that could be related, starting from the head, brain fog, migraines, depression,
Mhm.
anxiety, frozen shoulder. How many of your friends have frozen shoulder? That's all a hormonal drop in estrogen that creates that inflammation and that issue.
Uh-huh.
But basically, musculoskeletal symptoms, there's now a new musculoskeletal diagnosis of menopause, which is true. And basically, there are a lot of studies being done on that. Cardiovascular, there's huge amount of studies. Why do we get why does our blood pressure go up? Why does our lipid panel change? Even though we don't change the way we're eating or doing the cardiovascular exercise we mainly do because of the lack of estrogen is creating our arteries to be stiffer so they don't contract as much, and that's what drives our blood pressure elevates that.
Okay.
So just everything. I mean, some people feel, with lack of progesterone, we don't get our lung and oxygen transition as much. So harder for
Mm.
exercising. GI,
Yeah.
tons of GI
Mm.
discomforts. I'm sure a lot of the irritable bowel and all that is related
Uh-huh.
to changing in hormones. Just like when we get pregnant, what happens? We get a lot of constipation because your progesterone gets really high. So there's all these issues that make sense
Uh-huh.
what happened. And then, of course, in our pelvis, vaginal dryness, difficulty with intercourse because that's painful.
Mhm.
We can help with all that now that we know all these things.
Yeah.
And then, of course, bladder instability, urgency symptoms. I mean, all these things are related to hormones,
Okay.
but it affects each and every one of us in a different way.
Okay.
So, you know, you shouldn't blow off your symptoms and, finding a provider who will sit down and really go through your symptoms. It may be hormones.
Okay. And I think that's a good point. And for a lot of women who live in more rural areas, or maybe they just don't have providers who've got the same education and background, what is your suggestion for women who feel like they need more support, but they just don't feel like that's available to them locally?
So, the Menopause Society has an amazing website that has providers who will offer telemedicine care.
Awesome.
So, just going through that, but there's also a lot of new people who are standing out, like Dr. Mary Claire Haver has a nice podcast. She also has a website that can direct you to providers. Both the Menopause Society and Dr. Haver has lists that you can print out and take to your provider,
Great.
even though a primary care physician
Okay.
you can say, hey, I want to check these things
Uh-huh.
because the other big thing that you hear about is as we age and what accelerates the aging process, gain.
Okay. Yeah.
So, what's going on as we age, all of us, men and women, get insulin resistant, which increases your weight without changing your habits.
Uh-huh.
And the craziness of the hormones throughout perimenopause just accelerates that tremendously. And that's why women get frustrated with the weight gain,
Okay.
which then can lead to increasing cardiovascular disease.
Okay.
So, just understanding that, I think that's something that a lot of providers don't really connect.
Mhm.
And so, that is something that is on that list. It's really important to get your insulin levels, your hemoglobin A1C as part of your annual panel, which sometimes is not done.
Okay. That's another good point. A lot of times you hear about women going in and having getting these panels done, and maybe it's just like what the typical annual would be, and everything comes back and it says it's normal, but
Correct.
they feel terrible.
Right.
These lists are a little more in depth in terms of what panels to ask for
Yeah,
or
I
what.
think with the, we what we call is metabolic syndrome when our body starts functioning incorrectly, and that's why the insulin resistance goes up and we gain weight. I think there's other things that we need to check to make sure. Perimenopause has so many symptoms; they could also mimic other diseases. So that's why it's really important to get your blood panel. But in regards to hormones, if you're having periods, your hormone levels, the range of estrogen is, pretty much 40 to 600. So you're going to be in that range.
Yeah,
So unfortunately for hormones, it's not a great indicator that you're going through the perimenopause. It's mainly symptoms.
got it. Okay.
But it is nice to have a baseline to see where you're starting,
Uh,
especially to also get testosterone, because those are things that we can help supplement your body if we know they're truly dropping in you.
so if all your blood work looks normal, but you're having these symptoms,
There's something we can do
we
about
okay.
it. Bottom line is we want to help you, and there's many ways to do that. We have not only hormones, but we have non-hormonal ways that, we're getting new medications every day for all this. I
Mhm.
mean, exciting medication that just came out is Addie, the pink pill that's been approved for hypoactive sexual dysfunction, but we also are using that for perimenopausal women because our libido does go down,
Uh-huh.
probably because, some of our testosterone
Mhm.
as well as all the estrogen and progesterone, which affects libido, goes down as well.
I think for some people, the idea of HRT, I was talking to my mom about this. She was going through perimenopause around the time that they had just come out with those studies linking,
The Women's Health Initiative,
yes.
right, which was scared a lot of women away. Yeah.
And so let's talk about HRT now. Their new data shows that that wasn't necessarily
Yeah, I
linking
think
it to stroke is not.
correct. I
Mhm.
think a lot of that Women's Health Initiative study was not done interpreted correctly.
Okay.
So, unfortunately, it misled a lot of women. But also, you got to remember synthetic hormones.
Okay.
So, what we're using now is mainly bioidentical hormones, which all hormones need to be made. Just so everybody understands, there's no bioidentical doesn't mean it's a fruit picked off the tree and you can eat it.
Uh-huh.
Basically, they're all man-made.
Okay.
But what's important is in any hormone that you take, whether it be for thyroid or cortisol, other things, you always want to take it in a bioidentical form, which means it's made in the same form our body makes.
Okay.
And that was not what the Women's Health Initiative included, what we call Prempro, which are all synthetic hormones. None of them, the estrogen part or the progesterone, was in the same form our body makes.
Got it.
So there is no studies right now on
Got it.
hormones,
Okay.
basically.
Got it.
But what we have learned so far we've been doing this for the last 3 years. So
Mhm.
there's only data for 3 years now
Uh-huh.
on bioidentical hormones.
Uh-huh.
We have learned that estrogen, estradiol in a bioidentical form and done transdermally, either
Mhm.
through a patch or a gel or intravaginally is the safest route because it bypasses the liver and that's going to decrease your risk of clots, thus strokes and heart attacks.
Got.
So they're pretty safe in that regard so
Uh-huh.
far. But like I said, we only have 3 years of data.
Mhm.
And then the progesterone that we now use is bioidentical. It's micronized progesterone. And basically, that also, we don't have a lot of data on that as
Mhm.
well, but they're all bioidentical. And so we're hoping, and so far, what we've seen is no increased risk of clotting factors,
Mhm.
strokes, or cancers.
Okay. So for someone who's on the fence of HRT, the safety factor, the risk to benefit.
Everyone's different.
Okay.
So there are some things, maybe you have a genetic predisposition to certain cancers, which are going to limit your choices, but
Mhm.
that's why it's very imperative you see someone who's open to all this, who takes your history, who does genetic mutation testing to make sure you don't carry a BRCA gene, a PLB2. There's so many genetic markers that increase your risk of many cancers, specifically breast, ovarian, and uterine cancer.
Mm.
So those are the ones we're going to be more cautious. So it's always a risk benefit to anything you take, right?
We talked about some of the symptoms, the sleeplessness, anxiety, and the depression. other symptoms in the past haven't really been recognized as signs of perimenopause, but that maybe you see a lot coming into your office, women complaining of specific symptoms?
I think the main one I see a lot that maybe they go down the wrong rabbit hole for a
Uh-huh.
while is just the musculoskeletal aches of discomforts of
Mm.
menopause. I think we're really learning that, all our muscle and bones have estrogen receptors. And so the lack of that really increases that risk of having many things, ACL repairs, hip pain, musculoskeletal just difficulties, muscle aches everywhere. I think
Okay.
that's a huge one. I mean, insomnia is really big.
Yeah.
And so, I think a lot of women have been struggling. Even though we say perimenopause symptoms usually start to 40 to 60, it's not uncommon to start in your late 30s. And I
Okay.
think no one addressed those issues then. And a lot of women in that age group could improve their sleep, which is taking some nighttime progesterone.
Yeah. Okay. And I know that's the case. I mean, I've noticed a huge difference since taking progesterone and the estrogen too. My mom and I were just having this conversation the other day because now that it's being talked about more, she's been thinking back to when she was in her 40s and she went into her general
Physician
practitioner and was just like, I'm feeling really
off.
off.
Yeah.
And they gave her antidepressants. With HRT, when you increase your estrogen, can that actually help with some of those symptoms?
Yeah, right. It's hard to say that that isn't the right choice in that situation. But yes, that is something that can be related. In a woman, you always want to look at their hormones, especially we have girls that are younger and when they get that drop of progesterone by their periods, they get worsening PMS, they do get depressed.
Okay.
That's
Yeah.
that's why it's premenstrual dysphoric syndrome. It's actually a psychiatric diagnosis.
Okay.
So hormones we know affect those issues. What happens with postpartum depression? Same thing happens,
Okay.
but you get more of a sudden drop of all your hormones when you're breastfeeding, and that's what leads to the depressive like symptoms. So yes, I think that is something we need to explore with those patients. I'm not saying sometimes SSRIs we do use them for
Yeah.
those situations because they also help with hot flashes.
Oh, interesting.
So no hormone therapy is right for every single woman. Everybody has different nuances and we need to figure out. But yes, I mean, could hormones be affecting her in that way? For sure,
Okay.
especially in your 40s.
Okay. So that's just good to know. I mean, just basically, if you're having any of these symptoms, knowing that there is help and just working
Right.
really closely with your practitioner to.
Right. And I think, I'm grateful for some of these telemedicine platforms that have come out, especially during COVID when women really were struggling with a lot of these symptoms and couldn't see a provider. But also, it is important for you to physically see someone because,
Mhm.
unfortunately, I saw a lot of cancers from people that weren't examined and did not know they had certain things, breast masses, ovarian masses, bleeding, uterine cancer. So I think it's important to, whenever you start hormones, to see a gynecologist and make sure you're a good candidate
Mhm.
based on have no other findings on your exam.
Exercise, nutrition.
Yes.
Also,
So
things you
basically,
can
there's
do.
so much data as we age. We definitely need more protein. So creatine is huge.
Okay.
And I just read a study today. If you're over 60, you need not only the 5 milligrams, but they want you to do 20 milligrams
Okay.
per meal
Okay.
because this is geared towards increasing our muscle mass. And
Okay.
what we have found, and we're finding more and more, is that muscle and bone health is huge for longevity, but also decreases dementia, cardiovascular disease, as well as other things. So, focusing, I tell my patients, perimenopause is a wake up call to now you need to focus on you.
Great.
So for many years, we're taking care of other people and,
Uh-huh.
we go out the window. So it's a
Yeah.
wake up call to focus on you. What does that mean? Trying to focus on a Mediterranean healthy diet because studies show that that improves your longevity,
Okay.
makes your body function as optimally as possible. Starting to take creatine, 5 milligrams a day, starting to make sure you get calcium, 12 milligrams of calcium a day for our bone health. Making sure you get vitamin D, that's been shown to decrease midlife cancers as well as to help with everything, including muscle and bone health. So, vitamin D3 with K2 helps with absorption. So,
Okay.
this is just a wake up call to start doing all these things and focusing on us.
Okay.
Also, getting your labs will show if you have any other deficits, such as vitamin B12 and all those other things that you can start supplementing. but the diet is huge. And I love Lisa Mosconi is the lead investigator for brain health and women's
Okay.
health. And she wrote an amazing book called Menopause Brain, which is fabulous.
Okay.
But she says 80% of the time you can change your course and decrease a lot of these diseases by making right choices 80% of the time just with your diet and exercise. So
Okay.
we can do a lot,
Yeah.
and certainly diet is huge.
Okay.
Minimizing alcohol, which I know sometimes it's that relaxing at the end of the night,
Right.
but
Uh-huh.
that does, add up.
Uh-huh.
And not only does it lead to weight gain because we get more insulin resistance, but also can affect brain health.
Okay.
So, really focusing on a Mediterranean diet, doing at least 30 minutes of cardiovascular a day. And the main thing, besides adding creatine and protein to our diet, but also making sure we do strength training, resistance training at least 2 to 3 times a week,
Okay.
which is a huge change because,
Yeah.
forever women are focused on aerobic exercise, but strength and weight training is very important starting in 40.
There's some pretty scary statistics out there.
Yeah, so we're,
So,
most common ways we're going to die is from either cardiovascular disease or a bone fracture. So we want to try to help prevent those things. Studies show that another reason why women die is urosepsis. So we get more susceptible to urinary tract infections because as the changes in our vagina, gets stiffer, dry. It brings the urethral orifice opening. The urethra opening is where your urine comes out closer to the external area, and that increases our risk of your bladder infections.
okay.
So,
Yeah.
I think Dr. Kelly Casperson is a huge, as a urologist, fighting for women's health.
Uh-huh.
And they did a study showing that if everyone just put a little estrogen down there for the
Uh-huh.
rest of their lives, they will decrease the risk of dying from urosepsis.
Wow. Okay. That's good to know. Another thing I wanted to get into other things that you're offering now. So let's start with our skin changes
Right.
through this.
So skin is a huge organ in our body,
Mhm.
and basically it's dependent on estrogen, but also men get this as well. As we age, we decrease what? Collagen and elastin.
Mhm.
And when we start to lose estrogen, that increases dramatically to 30% within the first 5 years.
Okay.
So what does that mean? That means, unfortunately, our skin starts to sag and we
Mhm.
get wrinkles, jolts, all those wonderful things that we don't want.
Right.
So we offer in our office things that help minimize that to make women
Feel better and
feel
this.
better and look better. So, all using your natural body's reaction to increase collagen and elastin production.
Awesome.
So, radio frequency lasers, ultrasounds, things like that.
You're seeing a lot of women in the perimenopause, postmenopause phases. Are there specific subjects or questions, topics that you find women maybe feel hesitant to bring up in that maybe we need to be talking about more, that common symptoms that maybe aren't as well known that many women maybe suffer from that they suffer in silence because they're afraid to talk about it?
I think a lot regarding our relationships with our partner. So decreasing libido. I think some women, are really reluctant to express their concerns regarding that. And
Mhm.
maybe it's affecting their relationship, painful intercourse. I think some women also, we really get a lot more bleeding with their cycles and they're embarrassed to say that they're hemorrhaging or bleeding through their pants,
Mhm.
just things like that.
Okay.
And just being honest with their providers.
Mhm.
But I think the Menopause Society, like I said, has a really good checklist,
Okay.
maybe to explore before you go into your provider
Mhm.
so that you make sure you address these things maybe you didn't think. Some a very common one is itchy ears. Why does that happen? Because basically the lack of estrogen makes it dry in there. So, I mean, there's so many things that,
Yeah.
could come up with looking through that checklist that I
Mhm.
think, you don't need to suffer from that we may be able to help you with.
Yeah, that's excellent. So, the name of the podcast is Nowhere Near Done. I think a lot of women get to this phase and maybe they're starting to feel like they've spent so much time focused on their families, their kids,
Right.
and there is still a lot of life left.
Women need to realize it's not the end of the line for us. In fact,
Mhm.
there's so much more. It's actually great not to have a period every month. And,
Right.
there's so many benefits to being on the other side.
Mhm.
We live a third of our lives in menopause,
Mm.
so postmenopause.
Wow.
So there's so much you can do. And I
Mhm.
think as we see modern women out there thriving in this time of our lives,
Mhm.
They're great examples to show us that we can have a great time, and that's why we are here.
Uh-huh.
We wanna optimize those years so
Yeah.
that you can have the best years of your life and feel great and do the things you wanna do. Women, don't be afraid to talk about these things, and we wanna help you, and we're here to help you.
That was my conversation with Dr. Susanne Ramos. One of the things I appreciate most about Dr. Ramos is that she brings both science and optimism to this conversation. So often, women are told to simply accept feeling exhausted, anxious, uncomfortable, disconnected from their bodies, or less like themselves as a normal part of aging. What I hope this episode reinforces is that while perimenopause and menopause are normal transitions, suffering through them doesn't have to be. I also loved what Dr. Ramos said near the end of our conversation that this stage of life isn't the end of something. In many ways, it's the beginning of a new chapter. We can absolutely prioritize our health, build strength, protect our brains and bones, and create a future where we feel vibrant and engaged for decades to come. As always, I will link the books, resources, providers, and websites we discussed in the show notes so you can continue exploring and learning more for yourself. If this episode was helpful, please follow Nowhere Near Done, leave a review, and share this episode with a friend, sister, partner, or another woman who may be looking for answers. The more openly we have these conversations, the less alone we all feel. And remember, you are nowhere near done. See you next time.